Good afternoon. My name is Cobb-Phillips. I would be doing a knee and patellofemoral exam on myself, as I do not have a partner. First, I'm going to palpate the dorsalis pedis artery, which is on the top of the foot. All you do is feel for a heartbeat or a pulse. To palpate the posterior tibial artery, it'll be on the back of the ankle. Next, I will be doing a capillary refill test. All you do is squeeze a toe and see if blood refills fairly quickly. If it does not, then that means either something is blocking it, or you possibly have an ankle sprain or something with your knee. To see the active range of motion for your knee, for inflexion, all you have to do is bend your knee. To see for the flexion, bend your knee. For extension, extend your knee. For annual muscle test for flexion, you would need to push your knee down. For extension, extend your knee the other way. For the annual muscle test of the sartorius, you would bring your knee up, twist at the hip. So you would twist at the hip and see if there's any problems with your knee. All this is best done with a partner, because they can try to force it past what you can do. For passive range of motion for the flexion, bend your knee. For passive range, extension, extend your knee. For the apprehension test for patellar instability, you would push on your knee and see if there's any swelling, if there's any movement. For the sweep test, for the interscapular swelling / effusion, you'd push your knee and see if there's any fluid. For the valgus stress test for the medial collateral ligament, pull your knee sideways and see if there's any pain. All this is best done laying down, but I want you to see everything. Also, for the vagus stress test of the medial collateral, if there's any excessive gapping at the medial joint and or pain, there's possible MCL damage. For the varus stress test for the lateral collateral ligament, if it's the same as the last one, the LCL is possibly torn. For the Lachman test for the anterior cruciate ligament, you would just bend your knee slightly and see if there's a tear. For the anterior drawer test for the anterior cruciate, you would have to pull your knee upwards. It's better like this. You pull your knee upwards. And for the posterior drawer test for the posterior cruciate ligament, you would push your joint downwards. So it'll be right at the bottom of the knee. For the Schlockman drawer test for rotational knee instability, you would lay sideways and twist your knee. So after you twist your knee, if there is any pain at all, then tell the trainer to stop. For the posterior lateral drawer test, you would push on your knee and rotate your fingers around the knee to see if there's any tears or any pain. For the quadriceps active test, the trainer will ask you to flex your quad right here and see if there's any pain at all on your knee. For the proximal tibiofibular syndesmosis joint play, you would play with your knee and see if there's any tears. For the Godfrey's test for the posterior cruciate ligament, you would hold your legs up and see if any part of your knee just falls. If it does fall, then it's possible there's a tear. For the McMurray test for meniscal lesions, you would hold one knee up and twist in the air. For the Apley compression and distraction test, you will lay on your stomach. The trainer will push on your quad while they also twist your ankle and see if there's any injuries. For the crossover test for rotational knee instability, all you have to do is twist your knee inwards. So all this is connected. All you have to do is twist it inwards. And for the last test, which is the Nestle test for meniscal tears, you would stand on one foot and twist back and forth and see if there's any pain like this.